Hey guys, it's me again, your friendly neighborhood gynecologist. It is September, which is the month of PCOS awareness. So yes, you guessed it right. I will today have a heart-to-heart, or as I like to say it, an ovary-to-ovary chat with you about Polycystic Ovarian Syndrome, commonly called PCOS. Before I begin though, can I please ask you to subscribe? I use this channel to spread awareness on women's health, share my dance videos and talk about other things that excite me like fashion and travel. Give it a go. I think you will enjoy it. Okay, so coming back to the topic today, let us first understand what PCOS is. It is a condition that can affect a woman's hormonal balance, causing trouble with periods, fertility trouble, alter their physical appearance and also have long-term health impacts. It is quite common, affecting about 2 to 26 out of 100 women worldwide, which makes it very important to spread awareness, as with timely intervention the health complications can be prevented. What are the symptoms of PCOS? Now, PCOS symptoms include irregular periods or no periods at all, or periods delayed by many weeks or even months, an increase in facial or body hair, loss of hair on the head, unexplained weight gain, rapid weight gain, or having difficulty losing weight, oily skin, pimples, and difficulty becoming pregnant. These can also result in depression and psychological problems. The symptoms vary from woman to woman. Some have very few mild problems, whilst others are affected more severely by a wider range of symptoms. So how do we diagnose it? First, a detailed history will be taken by the doctor. If it is suggestive of PCOS, some blood tests to check for hormonal levels will be requested, along with an ultrasound scan of the pelvis. To diagnose Polycystic Ovarian Syndrome, at least 2 out of the following 3 need to be present. Number 1, irregular, infrequent periods or no periods at all. Number 2, abnormal sudden growth of facial or body hair, sudden outbreak of pimples along with or high blood levels of some hormones. Number 3, polycystic appearance of ovaries, which means when ultrasound scan shows that each ovary has at least 12 follicles, which are tiny fluid-filled areas. So you see, having only polycystic ovaries does not mean one has Polycystic Ovarian Syndrome if other features are absent. I'm sure you must now be wondering why PCOS happens. Simply putting, it is because for some reason hormone levels in the body go berserk. For a female body to work in sync during the reproductive age, there needs to be a balance of some hormones. From the top of the brain, we get a hormone called GnRH, which acts on the bottom of the brain to produce 2 hormones, LH and FSH. Both act on the ovaries at different times in different ways to produce estrogen and progesterone. Ovaries also make small amounts of testosterone, not as much as men have in their bodies though. This hormonal axis is a very fine-tuned process, almost like a well-choreographed dance sequence, and if one performer slips, the entire act fails. In PCOS, levels of testosterone and LH may be raised. These can cause symptoms like abnormal hair growth on body and face, loss of hair from scalp, and period problems. Then we have insulin, the hormone produced by an organ called pancreas that is found inside the tummy. We all know insulin is one of the treatments for diabetes, so yes, insulin is the hormone that helps to break down sugars in the blood. For some reason in PCOS, the body may be resistant to insulin, which means blood sugar level keeps on rising. This in turn whips the pancreas to produce more and more insulin as the body desperately tries to keep its sugar levels under control, leading to fertility problems, weight gain, and higher levels of testosterone. To tell you the truth, we do not know exactly why these hormonal imbalances occur. There might be some genetic element involved, as often it is seen to run in families. Being overweight can also contribute to the condition. Even though it does not directly cause PCOS, it can make it worse, as extra fat in the body causes further insulin resistance. This in turn leads to increased insulin level, which again causes weight gain, resulting in a vicious cycle. There are some long-term health implications of PCOS too, which makes it more important that problems are addressed on time. I'm certain you have been able to guess one of them. I have been talking about insulin resistance and it causing higher blood sugars, which means that with PCOS, one is more at risk of developing diabetes in later life. The risk is more pronounced if there are other added components like obesity, family history of diabetes, age more than 40 years, and certain ethnicities like South Asians. There is also more likelihood of getting diabetes in pregnancy with PCOS. Because of the effects of insulin resistance and higher weight, PCOS also can indirectly cause hypertension and heart disease. Women with PCOS, particularly if overweight, are more likely to have sleeping disorder called sleep apnea and can have snoring and daytime tiredness. The other possible long-term impact of PCOS thankfully happens in a small number of women. Now, when a woman normally has periods, the lining of the womb sheds. In the following few weeks, till the next period, it regrows, and if pregnancy does not happen, it sheds again. This is how the cycle is supposed to work. If, however, periods are delayed by many months, the lining of the womb keeps on growing and growing without the chance to shed. In a small minority, this uninterrupted growth can lead to cancer of the lining of the womb. However, please do not worry. One only needs 3 periods in a span of a year to minimize the risks, and there are easy ways to achieve that. Also, PCOS, though affecting ovaries, has nothing to do with cancer of the ovaries nor of the breasts. Now, the most important question of all, how is PCOS treated? Let me be honest here and declare that there is no magical cure for PCOS, but there are ways for us to address the problems and help our women lead perfectly normal lives. And the most important thing we can do is focus on weight reduction. I know that sounds unfair, as with PCOS, weight reduction is challenging. I acknowledge that. I know it's extremely difficult. It is also the best way to get the body back in sync. Weight optimization has a knock-on effect on insulin resistance and high testosterone levels, and as I have mentioned, these are the factors causing the problems in PCOS. So by reducing weight, the ovaries can restart making eggs as normal, periods can resume, and even hair growth can normalize. Please remember that no two body is same and there is no formula here. What works for one may not work for another. So if you find it difficult to lose weight by conventional means, you may need to consult a nutritionist and also enlist the help of a personal trainer. I have a few videos on healthy diet and exercises. You can check them out. The link will be right up here. If despite weight loss, periods are still grossly delayed, we prescribe some hormone tablets to help the lining of the womb shed. If getting pregnant is not in the immediate plan, we may also suggest going on regular contraceptive pills or trying the hormone coil. Even though they are not a cure for PCOS per se, they can keep some of the hormones under check and, more importantly, not allow the lining of the womb to unnaturally thicken. I should probably mention here that even though periods are delayed with PCOS, one can still get pregnant. So going on a regular contraceptive is highly recommended if there are no immediate fertility aspirations. Some contraceptive pills also contain a medicine that helps to reduce testosterone levels, thereby helping with pimples and body and facial hair growth. Excessive hair growth can also be controlled with some anti-testosterone medicines. However, they should always be prescribed by specialists and need to be taken for many months before any effect is observed. Also, these medicines cannot reverse the hair that has already grown. It's important to remember that. Unfortunately, there is no medicine for that, and depilation techniques like shaving or waxing or permanent laser hair removal are the options available. For acne too, the story is similar, as anti-testosterones can keep them under control and not necessarily reverse outbreaks that have already happened. Women with PCOS who are trying to get pregnant may need to consult a fertility doctor. And yes, at the risk of sounding like a broken record, I'll repeat myself here. The first advice will be to optimize weight. Fertility problems with PCOS happen as ovaries do not produce eggs as required, and lowering the weight can help to reset it. Sometimes medicines that stimulate ovaries to produce eggs may be advised, and occasionally a small operation called laparoscopic ovarian drilling may just help. There is also a diabetes medicine that is commonly used to control PCOS. You may have heard of it. It is called metformin. It helps to lower insulin, thereby offsetting the symptoms associated with PCOS, and also helps to minimize long-term risks. It does, though, commonly cause side effects like nausea or sickness, vomiting, tummy pain, and diarrhea. I feel like I've bombarded you with a lot of information here in a very short span of time, but I hope whatever I said made sense. If you need any clarification, please private message me on Instagram. My handle is here. And if there is only one take-home message from this video, I hope it is that the primary focus of managing PCOS is by lifestyle modification with proper diet and exercise. Seek specialist help if needed, and remember, you are not alone. In the video description below, I will include links to some of the online resources for patient information. There are some excellent support groups too, where one can talk to other women who are in the same boat. Before trying out any therapy though, please consult a doctor. Take care of yourself and please do not forget to subscribe. Thank you. Bye.